in these principles are some very, very real challenges. So whilst we use that phrase, right person, right time, right place, first time, 24/7, that's actually quite challenging in how we realise this.
Professionals from the acute sector and community services came together with partners from the third sector and the local authority to look at ways County Durham and Darlington NHS Foundation Trust can carry out more care closer to home.
The event today was really about trying to bring together our colleagues in community services with our colleagues in our hospitals and to try and get them to know each other a little bit better, start some conversation and some understanding of each other's roles. We know that we need, as far as possible, to move as much care as we can into the community because generally, as long as it's safe to do so, that's where patients want to be cared for and looked after.
The correct solution is about reducing dependency on hospital. It's about trying to stop patients coming into hospital, providing better care for them in the community, and it's about supporting their discharge into the community. But in the short term, we need to create capacity. And to create capacity, we need extra beds. We need extra beds for acute medical patients because they represent our major problem. Beyond that, however, we need to change the concept of where patients come to hospital for admission and then assessment, and we need to move to the notion that one comes to hospital for assessment and admission becomes a last resort.
Delegates were shown a range of presentations in order to inform and expand on the many and varied services available to patients in the community setting. Among the speakers, Jane Hayward, the Clinical Director for Adult Services, Geraldine Wolfe, Durham County Council's Strategic Manager for Operations, Older People and People with Physical Disabilities, and two well-received presentations from third sector organisations, the Red Cross and Age UK Darlington.
It's nice to know what services are available across the county because obviously that's what we're trying to do is integrate across the county and what have you, but certainly from the British Red Cross I was aware from last winter when they were walking around the wards introducing themselves to us and what services were available. This year it's certainly helpful to know that they've been based down in A&E and how to access them, and I've certainly taken away the telephone number for a contact for my wards and departments.
I think we've been really good in the fact that we've networked across within it, around the table, some of the things that we hadn't learned about community bases and what they offer. Telephone contact details so that we can get right person, right time. I was really pleased to hear about some of the things that were happening in community that we could help to fasten the patient pathway.
The pressures on the acute sector are clear, and it's hoped events like this one will continue to change the culture and approach to care.
I think it's been a really successful event, and I say that as somebody who sat on a table with community colleagues and hospital colleagues and some managers as well. And there's been some really useful conversations where people have got to know each other a little bit, started to understand a little bit more, started to have some ideas. I think that's really the important thing, people having ideas about how they might start to work differently, how they can communicate better, how they might develop services in the future so that we can actually change the way that we deliver services. So I'm hoping, I feel as if we've started some positive movement towards shifting some of our care into the community.
It was clear from the event that individuals from across the organisation would take away a series of actions to improve integration between the acute and community sectors. Chief Executive Sue Jakes was amongst those who made a personal pledge, and in her closing remarks she reiterated the support of the executive to help put ideas into action. She also revealed that an exciting new process to facilitate this would be revealed shortly.